Want to know how Samsung's multi-use solution for hospitals can improve clinical workflows, increase efficiency, and reduce cost? We'll show you. All right, thank you so much for joining us in the studio, man. I really appreciate it. Sam on from the healthcare team hanging out with us today to talk about Samsung's multi-use solution. Before we talk about what the solution is, let's talk a little bit about why we created it. Why did we create Samsung's multi-use solution?
So the nurses, they wanted a single, light, and mobile device, just like their existing smartphones, to allow them to complete all their tasks in the hospital. And the IT directors, their checklist included security, provisioning, easy management, and the reduction of the number of devices. And so for all these reasons, we created the Samsung multi-use solution, and we're the first to be able to answer all those needs.
All right, so that addresses the why, but how does it actually address that why?
So the Samsung multi-use solution is a single device that can do single sign-on with a tap of a badge. It can do clinical communications, scanning, access to mobile EHR, and true desktop-like experience through Samsung DeX and Citrix virtual apps gives full access to hospital systems and full EHR. As I mentioned, in hospitals, security is a top concern. With Samsung devices, we have Knox built in from the chip up, which keeps the patient data safe and also HIPAA compliant. And Samsung Knox Configure and Samsung Mobile Enrollment allows IT departments to easily deploy Samsung Galaxy phones already pre-configured with the applications and settings. With Imprivata mobile device access, single sign-on, you don't need to enter a username and password, which makes logging in more efficient. And we work with leading clinical communication partners to ensure that their solution works seamlessly on our Galaxy devices.
So healthcare professionals are used to a desktop-like environment. So what about those individuals that prefer that kind of experience?
That's actually one of the most exciting features of our Samsung multi-use solution. With Samsung DeX, which is a desktop-like computing experience, it allows us to plug this into a monitor or large format display. Once you're connected, you can access the Citrix virtual apps and get full access to all your hospital systems, including Epic Hyperspace.
All right, so what about access to electronic health records? Does this allow professionals to access all this information when they're on the go?
Absolutely. EHR access used to mean making a trip back to the workstation. But now, EHRs can be accessed directly on the phone and updated. This is a big time saver and it improves accuracy and ultimately allows for better interaction with the patient. With secure mobile access to EHR, clinical teams can quickly check and update patient records on the go. We ensure seamless access to the mobile applications of the leading EHRs like Epic Rover or Epic HiQ.
So what if a hospital is only using a Windows environment, which is pretty common?
The Samsung multi-use is truly a transformative solution. It allows nurses to get access to the information on their mobile device or on a desktop. For the IT team, allows them to reduce the number of devices, easier to manage, lowering costs, increasing efficiency. And through DeX, information can be shared with the patient simply with a mobile device and a large format display or patient room TV.
Regarding manageability, security, and cost, I'm sure that comes up a lot in your conversation. So what are we doing to address that?
Absolutely. Security and HIPAA compliance are top of mind. So Samsung Knox platform, working with the leading MDM platforms, work in conjunction to ensure that there is HIPAA compliance. And when it comes to cost, we have a broad portfolio of products, starting from the value tier all the way to our flagship Galaxy S and Note devices.
Awesome. Thank you so much for coming in. Sam on from the Samsung healthcare team. If you're interested in learning more, go to samsung.com/healthcare.